This is Nepal. It is a truly beautiful country. However, it's still struggling after years with political instability. Nepal is one of the most poor countries in the world, and its malnutrition rates are among the highest. Over 41% of children under the age of 5 are stunted. One of the things that I like the best about Nepal is that it's a country rich in traditions and culture. 83% of the population is Hindu, and there's always some kind of religious ritual going on. Life in Nepal is hard, and it's sometimes hard for me to understand the struggles that they go through. But they always still seem to be smiling. I should probably introduce myself. My name is Carrie Ann Augustin, and I study public nutrition at the University College of Oslo and Akershus. I live in Bhaktapur. It's a beautiful World Heritage Site city outside of Kathmandu. Bhaktapur is one of the areas that got the most affected by the earthquake. People are still living in shelters and tents, and the government is not really doing much to help the situation. I moved into a guest house, but it kind of feels more like I moved into a family. I have a mother, Rosni, a father, Krishna, and two adorable little brothers, Krishal and Krishan. And of course, there's also a grandmother. Every evening I eat dal bhat with my family. Dal bhat means lentils and rice, and it's the national cuisine of Nepal. The Nepali diet in itself is not so unhealthy. It's more the lack of variation that creates the problem. This is my way to the hospital in the morning. The shelter belongs to the Dalits, also known as the casteless people. They live off collecting garbage and selling it off. So this is my work, City Memorial Hospital. It's a private hospital for children and also an elderly home. Here I do mostly paperwork and prepare for my classes. And of course I also eat delicious lunch with my beautiful co-workers. Every Sunday and Wednesday we drive to the mother's clinic in Buda Timin. This is my supervisor, Dr. Ram, by the way. He works as a doctor together with his wife, Dr. Manu. I think they're truly an inspirational couple. The clinic is run by Chimalaya charity and reaches 25,000 people in the outskirts of Kathmandu. On the upper floor is the mother's clinic. Here you can see my two co-workers, Asha and Rosni, taking attendance of the mothers that come to the group today. The mothers group was established in 2015. The aim of the group is to educate and support mothers and giving them a space where they can interact and play with their children. I have regularly been having classes in nutrition and other health-related subjects. I also had yoga class with the moms. Actually, this is one of my favorite moments over here. The class was just really funny, and at the end of the class, I think we all were laughing so hard it was impossible for me to do the Om. The area where I put my biggest effort is in the neonatal visits. Together with Dr. Manu, I have created a checklist to bring to the home visits. I will bring you along for one of the visits so you can actually see what we're doing. Even though the conditions for mothers and children are slowly improving, neonatal mortality rates are still very high in Nepal. Also, 65% of women give birth at home, and they don't always have access to professional healthcare. Neonatal home visit is a recommendation from the World Health Organization, but it's not always coming true in Nepal. That's why Chimalaya Charity is planning to have 3 visits per newborn baby. At the home visit, we do a basic medical check and give information and education to the mother. An example of the information we give is, for example, hygiene care of the child, nutrition for the mother after delivery, and also we answer if she has any questions or concerns regarding her child's health. Promotion of breastfeeding is a key aspect for Chimalaya Charity and one of our main concerns in the home visits. Exclusive breastfeeding is one of the most effective ways to ensure a child's health, as recommended by both UNICEF and the World Health Organization. A breastfed child is 14 times less likely to die within the first year than a non-breastfed child. We try to educate the mother on the importance of breastfeeding and also answer if she has any questions regarding her practice. I wanted to introduce you to one of the moms that we have in our program. This is Shanti. She's an 18-year-old woman who works at the carpet factory 6 days a week together with her husband. She works there from 11 to 6 every day, and while she is at work, her little sister is taking care of her son. Her son is a healthy and active boy of 3 months. Through the program, we have talked to her about different subjects within nutrition, childcare, and also family planning, in hope that she can have an opportunity to give him the best start in life. The other aim of my internship is towards school children. I had classes for children in local and public schools in subjects within physical activity, nutrition, and hygiene. It's been a really nice experience for me, and I think also some of the children had fun. Here comes a little clip from my class at Chimalaya Primary School. You asked me about what I have learned, but you also just gave me 10 minutes of this presentation. I definitely feel that I have fulfilled all my learning objectives, and more than that. Every day has been a new learning experience, not only in nutrition, but also in what life is like in society that's very different from what I'm used to. It has been a very heartwarming experience. I am really grateful that I have been able to be a part of the work that Chimalaya Charity do, and it's been so beautiful to meet all these beautiful mothers and children